Yanni this morning. Mike, live on location. Jill has a couple days off. And Mike, you're at the Heart Fit Clinic, which is a really cool place.
Yeah, it is. Look at this. I'm already strapped in. I've got 2 arm cuffs on. Diamond here is already running tests on me. The whole idea this morning is to check out my ticker, assess my heart, see how healthy or unhealthy it is. This could be a bit frightening because you know nothing really about me. No, other than we chatted for about 5 minutes now. Yeah. So what I find out this morning is going to be live on air. So Diamond, explain for those who don't know at home what exactly the Heart Fit Clinic is all about.
Heart Fit Clinic is a cardiac rehab and a heart attack and stroke prevention clinic. So we see people who have heart disease already, but we also see people who want to know what the risk is of a heart attack or stroke.
So can anyone come in here?
Absolutely, yeah. We see anyone who wants to know really where the risk is of a heart attack or stroke and kind of bridge the gap in the healthcare system.
So don't need a referral from a doctor. You can just walk in, make an appointment, and say, I want to know
where your risk is.
Yeah, exactly. So first step, I'm assuming, would be conversation,
absolutely,
talking about risk factors, things like that.
Yeah, so first thing, we want to know where your risk factor profile is, your generic risk factor profile. And today we're going to run you through a gamma of testing that is not covered through our healthcare system. So you're not going to find these tests at your doctor's office or anything. So we look at a little bit more in depth as to what your risk is of a heart attack or stroke is. We'll go through that part of it. Over 50% of people with normal cholesterol end up with heart attacks. Why is that? We'll talk about that today. Yeah. People with normal cholesterol, you'll get a clean bill of health from your doctor's office, yet still be on the path of a heart attack or stroke.
So cholesterol isn't necessarily that one factor that says, yes, you can be in trouble.
Yeah, exactly. Yeah. It's inflammation, and it's hard to see where that inflammation is. So we'll do a bunch of tests with you today to kind of see where your response is.
The first one, I've got 2 arm cuffs on.
Yes. Yeah.
What's happening here?
So what we're doing here is we're looking at where your we're going to have some finger sensors on your fingers there, so we'll put that on here shortly with you. And we're going to look at how well your arteries are functioning, how well your arteries are reactive. So we're going to stop blood flow to your fingers, and you're going to feel a little bit, you'll feel that in a second, so you'll feel a little bit lightheaded and dizzy, but that's okay, I'm just kidding.
Boy, doesn't that sound like fun. Stop blood flow to all my digits.
So yeah, you're going to lose blood flow to your fingers there a bit, and then we're going to kind of sense this to see what's happening with that. So we're going to put these little finger sensors on you.
So Diane's going to put the finger sensors on me. I'm going to, I guess, take a few minutes here and do some tests, and we'll see you guys in a few minutes.
Good luck.
Yeah, great information. I mean, I think everybody would probably want to have that under their belt, right?
Yeah, it is good information. Need that baseline, right? Find out where you're going a couple of years from now.
Yeah. We'll catch up with Mike Yanni again. Always, and speaking of information, Mike Yanni's getting a whole bunch of that at the Heart Fit Clinic. Mike?
I sure am. First test is done. I'm still hooked up because it just finished. Diamond is not telling me my results. You're going to find out just as I do, live on television, coming back to the break. Let's see if I pass the first one. You're watching Breakfast Television on City.